Hello everyone, I am Dr. Nisha Bhatnagar, Medical Director at Avya Fertility and IVF Center. First of all, let me tell you what is recurrent miscarriage. Any pregnancy which gets terminated before completion of 20 weeks of pregnancy is termed as miscarriage. If a patient goes through this miscarriage more than 2 times, it is called as recurrent miscarriage. Around 15% of the patient go through this again and again. Around 20% of infertile couples face this problem one time or another. This recurrent miscarriage is usually of 2 types. Early recurrent miscarriage, which happens in the first trimester, or late recurrent miscarriage, which happens after 12 weeks of pregnancy, before 20 weeks. In early recurrent miscarriages, which is happening before completion of 12 weeks, mostly the reason, in 60% of the times, the reason is genetics. That means that there is some sort of genetic problem in the embryo or in the conceptus. That is why the body is rejecting it. So the first important cause of first trimester abortion or early trimester abortion is genetic. When we talk about genetics, we know we are talking about the egg, the sperm, and the conceptus, which is formed by making the egg and sperm. Another important factor is the microbiome inside the uterine cavity. So we have seen if the microbiome inside the uterine cavity is not optimum, there is some sort of subclinical endometritis. It also results in a recurrent miscarriage. It can cause some sort of inflammation in the uterine cavity, resulting in discarding of the embryo by the uterus. So the third important reason is the environment or the body. The first thing in here is the metabolic disorders, like the lifestyle, the medical condition. For example, if the patient is suffering from hypothyroidism or has diabetes or has hypertension, or if there is some sort of inflammatory autoimmune disease like SLE, the chances of recurrent miscarriage is higher. Another important factor is immunological factors. There is an abundance of killer cells, natural killer cells in the body, which results in the rejecting of. There's a lot of research going on these immunological factors, and still we are not sure how much role does it play in the recurrent miscarriages. But we have seen certain cases where we try to give some sort of immunoglobulins, and it has resulted in continuation of pregnancy. Another important factor when we talk about environment is inherited thrombophilias. So in these inherited thrombophilias, there is formation of small clots, some sort of bleeding disorder is there, and clotting of blood happens inside the veins, which results in defective placentation. This defective placentation can cause PIH or IUGR, or in some cases recurrent miscarriages. One thing I want to add here is most of the people are advised to go for repeatedly TORCH test to rule out recurrent miscarriages. TORCH has no role to play in recurrent miscarriages. You need to understand that once you get infected, once a patient gets infected by these viruses, the body develops immunity. It may result in one-off abortion, but the next time the patient has immunity against it, and it will not be a cause for recurrent miscarriage. If we talk about the embryo factor, we need to first of all improve the lifestyle. You have to eat healthy, you have to start exercising, you need to take antioxidants, you need to see if what group of age you are, what is the AMH, you have to stop smoking, you have to stop drinking, you have to adopt a healthy lifestyle so that the egg quality, the sperm quality, and the resultant embryo quality can be improved. Second thing is, if it is because of genetics, you can opt for doing a pre-genetic testing of the embryo to rule out any aneuploidies, and that those embryos which are euploid will only be transferred. Coming to the uterine factors, you need to go for a small procedure called hysteroscopy, which is considered a basic investigation for all recurrent miscarriages. We put a small scope inside, we see the inside of the uterine cavity, and we see if there are any polyps which are removed, if there is some mucous fibroid which can be cleared, if there are some adhesions which can be cleaned. A testing for tuberculosis can be taken to find out if the tuberculosis is there or not, and if there are any septa which can be corrected. Most of the patients who have had recurrent miscarriages, if there is any septa or anything which is cleared after doing hysteroscopy, can continue the pregnancy till term in the later on. Now the third part is cervical incompetence. For that, you need to do a simple basic scan in the initial part of either in the initial part of pregnancy or in the intrapartum period, where you know if there is a funneling of the cervix which is taking place. In these cases, abdominal cerclage, or if you are pregnant, a cervical encerclage can be planned to prevent the miscarriage from happening. There is some role of immunoglobulins like Bharglob and lipid infusions, but this is still experimental. You cannot be certain. In some patient it works, some patient it doesn't work. Then comes the inherent thrombophilias. For this, according to the various tests can be done for lupus anticoagulant, anticardiolipin, factor V deficiency, protein C, protein S, all these needs to be tested and the steps taken accordingly. Sometimes despite doing all the investigations, you may not know exactly why this is happening. There are cases with unexplained recurrent miscarriages. In such cases, oocyte donation or even in rare cases, surrogacy may be of some use. Please feel free to contact us at the given numbers to know more about it. Thank you.